Also important is that when patients return to work, they're going to be on a liquid diet for 2 weeks. So they have to be in a situation where they can have easy access to the liquid that they need. There are some nursing units where the nurses can't have liquid at their stations. Some correctional facilities, they can't have water bottles in the workspace, other types of jobs. So if that's the case, people would be off of work for a couple of weeks to make sure that they can maintain their liquid intake and have easy access to the liquid intake immediately after surgery.
Okay. So you're on the liquid diet for a little while after, and then do you just jump back into regular size meals, just healthier meals, or do you have to start with smaller portions? What does eating look like post-surgery?
Exactly. So patients are on a clear liquid diet for 2 weeks. Then we advance them to a full liquid diet that includes some elements of pureed foods. After another 2 weeks, we advance patients again to softer foods. These are soft meats, softer fruits, vegetables, things like that. And then after about a month, they advance to the final diet. But this diet is now composed of very small portions of healthy foods. After bariatric surgery, and this is one of the benefits, you're not able to eat very large portions. Your stomach is smaller. Your appetite can also be decreased as well. And so the portion sizes are much, much smaller. I have one patient who told me that she goes out with her family or has dinner with her family, and they make her what's called a mom-sized portion. And that's what they call a very, very small portion.
But it's enough that you're fulfilled, and that's the amount that you should be eating.
Absolutely. And it's very remarkable that after these surgeries, patients don't report that they are hungry the way they used to be. Part of this is the way your hormones that affect hunger change after surgery. Part of it is the anatomical changes. And part of it is just the habits they learn in the preoperative program. You learn that you don't need to eat the whole big meal that you would get at a sit-down restaurant, for example. You don't need to eat multiple portions when you're cooking at home. You can just have a very small portion. And most people are really amazed at how little you actually need to eat to maintain your metabolic level.
Okay. But surgery also does not mean that you have to give up everything that you enjoy about foods. I heard Lynn say that she'll maybe have a cookie.
Right, absolutely. And, you want to enjoy what you're eating and enjoy spending time with your family and friends and enjoy a meal with them. And patients can do that. You just have to be mindful of what you're doing. You have to have smaller portions. And again, most people, after the preoperative program of usually 6 months, and after going through the surgery and having the big changes, they're completely on board with just having very small portions and making a big change. They realize you don't need to have multiple portions to enjoy a meal.
Right.